Welcome, everyone, and thank you so much for joining today's webinar, Federal Policy, How to Make an Impact with Long COVID Support and a National Task Force, jointly hosted by SolveME, marked by COVID and the Long COVID Alliance. My name is Emily Taylor. I'm the Vice President of Advocacy and Engagement for SolveME, and it's absolutely my pleasure to welcome you to this webinar. We'll be spending the next hour together. Before we begin, a couple of housekeeping items. Again, this webinar is recorded, so we encourage you to share your questions via the Q&A function on your screen. We'll answer as many questions as time permits. This is a safe space focusing on information about two important bills. So given our limited amount of time, we ask that you keep your questions and comments focused to the areas of advocacy and touched by these two pieces of legislation. If you would like to enable captions, you can use the show subtitle button to enable that assistive technology. And again, this webinar is recorded, so your participation is consent to be recorded, and the recording will be made available after the completion of the event. Also note that we cannot provide any medical or legal advice. These webinars are for informational and educational purposes only. With that, I'm so pleased to turn it over to your moderator, Liza Fisher of the Long COVID Alliance.
Thank you, Emily. Hi, my name is Liza Fisher, and I'm on the executive committee of the Long COVID Alliance. I'm also a patient advocate and patient myself. We're going to be reviewing the National Task Force on the COVID-19 Pandemic Act, and we have several speakers today. I'd like to introduce Gilbert Ruiz. Gilbert Ruiz is a legislative director for Senator Kristen Gillibrand from New York, where he has worked for nearly 8 years. He is an alum of Baylor University and American University, where he has degrees in medical humanities and sustainable development. Now I'll welcome Gilbert.
Thanks so much, Liza. Hi, everyone. Nice to meet you all. I'm Gil Ruiz, the Senator's Legislative Director, and I'm proud to discuss with you today the National Task Force on the COVID-19 Pandemic Act. I'm proud to have worked on this bill for a long time now, even before I was her Legislative Director. I was her health and homeland security lead, amongst other things, and worked on this bill directly with the Marshall staff, the Ernst staff, and the Feinstein staff very closely and collaboratively, and Senator Casey, who joined us as well on the bill. This bill originally began its origins began in the issue of COVID origins when Senator Marshall and Gillibrand passed an amendment 96-0 in the U.S. Innovation and Competition Act, the artist formerly known, before CHIPS was known as the U.S. Innovation and Competition Act, became CHIPS, in which the amendment declared that COVID origins is something important enough to talk about. Very plain and simple. Our work on this, brought us to work closely with the Ernst and the Feinsteins on their work with the commission as well. They had a bigger bill just looking at that we were also original co-sponsors of the entire response to COVID and globally. We wanted to focus that a little bit more. We redrafted to make it the National COVID-19 Task Force Act, which focused on the U.S.'s response to COVID, including its origins and the whole 9 yards. We really wanted to be able to look at New Yorkers in the eye and all Americans and be able to tell them with assuredness that we've done everything we could to prevent the next pandemic, this giant thing that has disrupted every single person's lives. It's still disrupting lives. It's still hurting people. We still haven't fully recovered. A lot of us haven't physically recovered. And it's that right there, that issue right there that we feel is so important to address. We kind of can't believe that this bill hasn't been passed yet. It's bipartisan. It was included in the Prevent Pandemics Act and passed out of committee. We're working through the administration's concerns with some of this. As you can imagine, nobody likes to, have their dirty laundry aired out and about. So we're trying to make the case as to why this is too important to ignore and just kind of move on from. We do need an independent assessment. There are so many valuable lessons from this pandemic that should inform our future preparation. And just as we established an independent commission in the aftermath of the September 11th attacks, Senator Gillibrand and her colleagues want to pass this bipartisan task force on the COVID-19 pandemic to arrive at what we need to do for the future. After 9/11, the 9/11 commission, we ended up with a whole new agency. Who knows what would come of a COVID commission? We don't even know yet. The unknowns there are too big for us to, I think, at this point, to understand. Um, and the things we do know, are still disputed. There's still, misinformation out there, and we don't have recommendations about how to move on from them. The extent of the loss of life and the economic cost of this pandemic, demonstrates the high risk of global health crises. It underscores the possible havoc that future pandemics could cause if the U.S. doesn't prepare now, learning from its mistakes. We need to address our vulnerabilities and prevent future health crises with an authoritative and independent review of the COVID-19 pandemic's origins and our response. This task force will be composed of 12 members, 6 members appointed by each party, excuse me. And the task force would conduct an investigation into the COVID-19 outbreak and identify lessons learned regarding preparedness, response, and recovery. Specifically, it would address the U.S. government response, public health messaging, international cooperation in responding to and investigating COVID-19, the availability of medical supplies and PPE, the development and distribution of treatments and vaccines, the capacity of the U.S. healthcare system, language variations regarding novel diseases and how that relates to stigma and discrimination for certain communities, the origins of COVID-19, of course, and any other subject the task force determines relevant in developing recommendations to prepare for future pandemics. Obviously, a big part of this, in the U.S. response and, the public health messaging, the development of treatments and vaccines, what we've heard so much from the long COVID community about how not enough attention has been paid to what they've been dealing with, and we think this is a really comprehensive way to tell that story, to put it into context, and to make sure people understand how important this is and how many, the totality of people suffering. And I think I'll try to leave it at that because I know we're kind of short on time. I'm happy to answer any questions.
Thank you, Gilbert. We will definitely get back to questions. And at this time, I'd like to take a moment and introduce Kristin Urquiza. Kristin is the nation's top disaster equity advocate with expertise in race, economic, environmental, and health policy. An experienced grassroots organizer, Urquiza co-founded Marked by COVID and catalyzed the nation's foremost community-led justice movement days after the death of her father, Mark Urquiza, to COVID in June 2020. By uplifting impacted voices, Kristin improves nation's COVID response, advanced legislation for a just recovery, recognition, and pandemic prevention. She holds a BA from Yale University and an MPA from UC Berkeley's Goldman School of Public Policy, and is the recipient of Arizona Public Health Association's 2021 Community Partner Award and the Goldman School's inaugural Alumni Award for Social Justice Impact. Thank you for joining us, Kristin.
Thank you, Liza. And Gil, thank you so much for being here and continuing to show up for our community in a myriad of ways, as well as the Senator's leadership on this bill. I am excited to be here with you all to talk a little bit about just, what does this bill mean from the perspective of the community that I work the most with, which are folks who have lost loved ones from COVID, including also people in that category who are suffering themselves from not only the economic fallout of losing a breadwinner, but also many times the health fallout. We did a community needs assessment not too long ago and learned that a third of people who've lost a loved one from COVID within our community also identify as having long COVID. So these issues are all very connected and interconnected. And going to what Gil was saying, from the perspective of people who have lost a loved one, while we know nothing can ever bring back our loved one, the thing that is so incredibly important to all that we've lost is ensuring that those deaths were not in vain. And that even more increasingly from that we do not rewrite history to a point to say that our children and grandchildren are sort of looking at COVID as, oh, I remember my parents and grandparents not talking about that. And I feel like that's when we all started to work remotely. We are in jeopardy of walking that path if we do not take simple measures to ensure that what happened underneath the public health emergency ordered is recorded. As a taxpayer in this country, it is incredibly important that we look at how we have spent trillions of dollars in government and public funding to address this public health crisis, irrespective of not, my father passing. I think that is important that we have a record of how that money was spent. So that we can learn, we can iterate, and we can continue to do what this country has done so well at our inception, that whenever we have the courage to face ourselves, we can continue to be better and rise to the occasion of who we say we are in those foundational documents that really, are what this country is built upon. So this task force is something that Marked by COVID has advocated for since our inception in 2020. I have personally worked alongside not only Senator Gillibrand's office, but others to bring the first person perspective to our lawmakers, both on the local, state, and national level, to help educate members about the importance of this, and that we are not looking for a witch hunt of one party or another. There are things that both sides of the aisle and folks in the middle did well and didn't do well. But what we need to be able to do is have the courage to pass on to future generations the unvarnished truth of what happened and why, so that we can ensure that the next time something happens, whether it's a virus, whether it is something else, because there will be a next time, we are not flat-footed. We're able to communicate succinctly what the threat is and help people make the decisions and choices to be able to protect themselves, their family, and their greater community. So this has been a big reason why we've been a proponent of this. And again, incredibly appreciate the leadership of the senators working together across the aisle to continue to bring this resolution to the forefront. I will close by saying, just sharing a couple of exciting updates just from the grassroots advocacy side. One of the things that we do is help encourage people to take action, whether it's signing an online petition that generates a letter into their lawmaker, or doing something more out there, like joining me for a lobby meeting with members of Congress or their staff. We have to date organized over 6,000 people to send in individual letters in support of this task force legislation, representing folks in every single district in the U.S. Congress. We've also helped to organize almost 60 other nonprofit organizations to be in solidarity together, including SolveME and the Long COVID Alliance, to say, listen, this is important to our constituency group, because as Gil said, that context as to what happens, how we address or do not address post-viral illness needs to be codified so that we can have the courage to rise to the occasion, to put aside the funding support and resources to ensure that we're continuing to study and provide people relief, support, and services. And, we have been continuing to share ways in which people can get involved, so that in the coming weeks and months, as our lawmakers are thinking about this, as opportunities are coming for this to get more support, they know that the public is behind us. And I guess I will end with that. I'm just a kid who lost her dad at the end of the day. I was really doing okay in my life. I had just graduated from graduate school. I was looking on making a sort of some switches in my career, working in the environmental space to working in the public health space. And then this public health catastrophe came home into my family. And at the end of the day, I was reduced to a person who felt like I had no agency in my story and in protecting my family. But what I have seen happen over the course of the last several years is that despite what you see on the television, despite the vitriol that there can be online, when people come together, whether we're Democrats, Republicans, independents, non-party affiliation, and work together on the things that matter, ensuring that we have answers as to why this happened the way that it did, we can do incredible things together. So to all of you out there listening, thank you for your courage in being here, your courage in wanting to make this world a better place. Our children, our grandchildren, and our country deserve that. So I'll pass it back over, and thank you again for being here with us today and allowing me the opportunity to share a little bit of my perspective on this.
Thank you, Kristen. Next, we'll move on to Samantha and Michael and discussing the Long COVID Support Act. First, we have Samantha Kohler. Samantha is a senior health policy advisor to U.S. Senator Tim Kaine of Virginia. Her work for Senator Kaine encompasses health policy as it relates to public health and access to coverage and care, including long COVID. Previously, Samantha served as a policy advisor to U.S. Senator Bob Casey on the Senate Special Committee of Aging and focused on Medicare and Medicaid policy. Prior to this, Samantha was a direct practice social worker for older adults. She has her MSW and MPH from the University of Michigan. Welcome, Samantha.
Hi, everyone. Really nice to be here today. As Liza said, I'll spend a few minutes talking about Senator Kaine's work on long COVID, and I'll particularly focus on his bipartisan bill with Senator Young of Indiana, the Long COVID Support Act. I think I have to start by sharing a little bit about Senator Kaine's interest in working on long COVID. He has been pretty open about his journey with long COVID. He had COVID in March of 2020, just as things were shutting down in the country. And one lingering issue that has remained from his COVID infection more than 3 years later is this persistent tingling sensation. And I like to describe it in the same way that he describes it to everyone. He says it's as if every nerve in my body has drank 5 cups of coffee, and it's always there across his whole body. And, while his experience with long COVID has been mild, it wasn't long after he realized this is something that's not going to go away that he wanted to start publicly sharing his journey and talking about his experience with long COVID. And, as soon as he started sharing his own experience, he started hearing from people across the Commonwealth of Virginia, across the country, and even internationally, hearing from individuals about their own long COVID journey. And while his experience has been mild, we know that many people's journeys with long COVID have not been mild, and that people's lives have really been dramatically changed due to their own personal long COVID experience. And, in response to his experience and what he was hearing from Virginians and people across the country, in March of 2022, he introduced his long COVID bill, the Care for Long COVID Act. That bill has a companion bill in the House and has a really robust group of Democratic support co-sponsors here in the Senate, and over 50 organizations that have also supported that legislation. And while he had been working really hard to try to make that bipartisan, it wasn't until earlier this year that he was able to make that bill bipartisan, working with Senator Young of Indiana. And that bipartisan bill that he introduced with Senator Young of Indiana takes provisions from the Care for Long COVID Act and reintroduced them as a separate standalone bill, which Liza mentioned, the Long COVID Support Act. And the Long COVID Support Act would do primarily 3 key things. One, it would further research by supporting a registry, which would collect information on long COVID and related individuals with long COVID and related conditions, voluntary. It would also improve understanding of long COVID treatment and efficacy and disparities, including through supporting work at the Agency for Healthcare Research and Quality, which really does focus on patient-centered care and how can we improve information going to healthcare providers that then are working with and treating individuals with long COVID. And then finally, the bill would also improve education to the general public and to providers, both on the diagnosis and treatment of long COVID. So how can we speed up that information that is coming out of research, getting to the individuals and to patients getting the individuals that care for patients and patients with long COVID so we can improve patient-centered practices. So, for this fiscal year, the fiscal year FY 2023, which is what we are in for the next couple of days still, Senator Kane also helped secure $10 million that went to the Agency for Healthcare Research and Quality, AHRQ, to do some of this patient-centered work that I just mentioned that's included in his bipartisan bill with Senator Young. And then that money actually, earlier this month, the AHRQ put out an announcement that they were going to be funding 9 long COVID clinics across the country, and that money would go towards expanding comprehensive and coordinated patient-centered care for people with long COVID. So the funding for those organizations was just announced, but that should be going out the door this fall to help improve care at those long COVID clinics. And then we also know that the same level of funding was included in the FY24 Senate appropriations bill. So obviously that funding has not gone out the door, but we're hopeful that we can keep fighting for it. So AHRQ will have additional money to go to more long COVID clinics to impact patient-centered care. And then, as far as next steps, it is amazing that we were able to make the Long COVID Support Act bipartisan. That is a huge step, and quite honestly, credit to the advocates, those on this call, those hosting this webinar, those listening to this webinar. Thank you for all the work that you've done to talk to members about this bill. But we're always aiming to get more bipartisan support. And then beyond that, if we're not able to get more bipartisan support on this bill, there are always ways to try to move provisions of this bill outside of the bipartisan legislative process. One thing we try to do is see about moving packages through committees and how we can get provisions from this bill included in packages that are moving through the committees. Gil mentioned this earlier on the bill that he's working on, and also provisions from Senator Kane's Care for Long COVID Act were included in and the Long COVID Support Act. The provisions related to supporting AHRQ were included in a bill that moves through the Health Committee this year. So that's kind of the other way that we'll continue to try to move this bill through committee. I am going to stop, and I could keep going on and on about the work that we're doing, but happy to take any questions that anyone has.
Thank you, Samantha. At this time, I'm going to introduce Michael Sieverts, and we'll circle back with questions for both the Long COVID Support Act and the task force. Michael Sieverts has been living with the disabling symptoms of long COVID since his acute affection in March 2020. As a patient advocate, he works with the Patient-Led Research Collaborative, the Long COVID Alliance, the Network for Long COVID Justice, and ME Action. He has background in science and technology policy. Over the course of almost 40-year career in public service, he has worked for the Congressional Budget Office and National Science Foundation. Welcome, Michael.
Thank you, Liza. And I do need to start with one quick disclaimer that I am still a federal employee, but I'm appearing today strictly in a personal capacity. So this is unrelated to my work as a federal employee. But I do want to first thank Samantha and thank Senator Kane for all they've done. They've been incredibly valuable to us in the communities, first and foremost as validation, just having a public figure of that renown speaking up, sharing the experience, and letting patients know that somebody out there is really aware of what you're going through, what we're going through. I want to bring Samantha back because I sort of want to draw her out on a couple of issues that she brought up. And first, just kudos beyond belief for getting this to be bipartisan. We've been working, we've been hoping to see that for so long, and that really is a huge step forward. And in one of the email exchanges you and I had, you said, I mentioned the op-ed that Senator Kane and Senator Young and former Senator Inhofe did in the periodical, the magazine The Hill. And you said you could comment on op-eds as a tool for bipartisanship. So say a little bit about that if you could.
Sure, that's a great question. So, and maybe not to put webinar focus on the spot, maybe we could put a link to that op-ed in the chat or share it down when you guys send out some information afterwards. But essentially, Senator Young and Senator Kane and former Senator Inhofe did a bipartisan op-ed in the Hill that, the high level was saying, we are all members of Congress that are experiencing or have experienced long COVID. And here are some things that we think that Congress should be focused on as it moves forward in addressing long COVID. And, everybody has their own journey when they talk about their healthcare and the things that they're experiencing in their health. And so I certainly couldn't speak to the other members and their decisions to talk about their experiences with long COVID. But what I can say is that, it isn't often that you get members to agree on things that can be a little bit controversial at times, whether or not we think long COVID should be considered controversial. We were really excited to work on this op-ed with them. And I think it's a great tool for bipartisanship to have people on different sides of the aisle talking about an issue where they share common ground. And now that is out there in the public and something for us to point to, that this doesn't have to be a partisan issue, that there is bipartisan support for doing these things that were outlined in the op-ed, a lot of which are outlined in the bill that Senator Kane and Senator Young introduced. And the bill itself is also called out in the op-ed. So we were incredibly thrilled to put that out there.
We were thrilled to see it. Because we've been making sure it gets lots of mileage on social media and elsewhere. And it's been great to have. Gonna stray a little bit on top now, but I want to ask, so Senator Kane is on the Health Committee, Health, Education, Labor, and Pensions. And sometime in the next month, I don't know if it's scheduled yet, the committee will hold a confirmation hearing for Dr. Monica Bertagnolli, who's the president's nominee to be the director of the National Institutes of Health. And I just want to get your thoughts on how Senator Kane is approaching that hearing and whether he's, what we can do to encourage him to raise the importance of research on long COVID with Dr. Bertagnolli.
Yeah, that's a great question. As of this morning, I have not seen the specific hearing been announced from the committee, but what I have seen is that the Chairman Sanders, said that he was committed to holding that, and I believe he mentioned later in October, so we don't have a specific date just yet. And while I haven't spoken to the senator specifically about what topics he'd like to address, I would say generally anytime over the last couple of years, anytime the NIH director is in front of the health committee, he has asked about their work on long COVID. And I know just from the outreach that he's received through, all the advocates that know to come to us, and also through our general mail intake that anybody can write in and share their experiences, we've received quite a bit of outreach of people interested in updates. And I think it would really be great for us to get an update from the NIH of, okay, what is going on? Where are things at? Here are some of the concerns that we've been hearing, and how can you address those?
I'm going to pull a couple of questions that came up in the Q&A. One is, for the Support Long COVID Act, is there a House companion bill yet?
There is not. But again, the Support Long COVID Act has the three main provisions I mentioned in the Support Long COVID Act are pulled from the Care for Long COVID Act, which in the House, actually, the Care for Long COVID Act is bipartisan and has been for a couple of years now. So while we don't have a companion of Support Long COVID in the House, the Care for Long COVID Act is bipartisan over there. And we've had great support from our House leads.
I don't want to put you too much on the spot, but were there aspects of the original bill that, what needed to be changed to get bipartisan support? I mean, it's useful for us as advocates to know what are the universally well-regarded aspects of it, and which might be seen as more partisan, if you can share any of that.
Sure. Yeah, I think the biggest component the biggest difference between the two bills would be that the Care for Long COVID Act has a provision in it that would provide funding to the administration for community living on how we can provide supportive services to people living with long COVID. So not just how we're putting, not just information, how are we messaging and making sure that people are aware of the services, but actually providing funding to community organizations to provide those services. And the bill was specifically focused on how we can bring together social services and medical legal services. And that provision of the bill was actually really driven by advocates and was probably when we were initially writing the Care for Long COVID Act in late 2021 and into 2022, that was one of the top issues we were hearing from individuals with long COVID of we are experiencing these issues. There aren't enough resources on the ground for people. It's not just adults getting long COVID, children, and those are unique issues that kids in schools are facing. They need advocacy, and also the general issue of advocating the disability process, which is difficult in normal times, let alone adding the complication of long COVID and having unclear guidance of how to show that you're experiencing those issues. I know since then, the Social Security Administration has put out some additional guidance, which is great. But I think we continue to hear from individuals of some of those issues navigating services and also just finding those services in their local community. And ultimately, we were not able to include that in the bipartisan bill. And I think the biggest thing is doing something like that has a cost associated with it, providing funding to the Administration for Community Living to then put out grants to community-based organizations. We're in kind of a difficult budgetary time at the moment. And so any additional spending is harder to get bipartisan support on.
And one other question from the Q&A, and it plays off that Senator Kane, Senator Young both have been public about having long COVID. One of the questions is there a long COVID caucus? And so the other phrasing of that question would be, how many members have been public about having dealing with long COVID? Do you have a sense of that?
As far as I'm aware, there is not a long COVID caucus. There's always a chance I wasn't made aware of it, but I feel like if there was one, we would know. And those are the only three individuals that I'm aware of that have been public about their story.
Mm-hmm. And final question, what do you think are the most effective ways that advocates can engage the Hill? What are the things we can do that are most helpful to you and other congressional staffers and members' offices and committees?
I love this question. I think I will start by saying I think the organizations that have led this call are doing really great advocacy. And even, judging by attendance here, you guys are doing a really great job in doing outreach. I would say for a regular person listening in, wanting to know how they can have their voice heard, the best thing that you can do is look up who your elected officials are, your senators, your representatives, and then write into them. We go through all of our mail, we respond to all of our constituents. It's best if you are a constituent of that individual, because that's more likely that you're going to get a response. Like if you are from Colorado and writing into a Virginia office, you might not get a response because you're not a constituent. But sharing your personal story and the impacts that has had on your job, your family, your personal life, your medical experience, putting a face and a name to those things is so helpful. And then being a part of advocacy organizations, because those organizations organize Hill Days, which is either physically coming to DC, or sometimes if you're not able to make it to DC, they'll do virtual Hill Days where you can do Zooms with individuals, with staffers from offices, and kind of share your experiences. That's the best thing that you can be doing.
So one question out of that is, what counts as mail? Does it need to be, is email as effective as snail mail? Does that matter?
Mail is mail.
Mail is
So I would say emails are great. You'll find if you go to your elected official's website, there's normally like a contact us page, and you can just like write in your story. You can send snail mail. I will say snail mail takes a lot longer to get to us because there's a central processing facility that opens all the mail and like screens it for any hazards before it makes it to us. So any snail mail takes 2 to 3 weeks to just get to us versus an email is a lot, the contact form on our website is a lot faster. Sometimes organizations do like form letters, like they'll have a letter typed up and you just plug in your name, your contact info, and that form letter will automatically go to an office. I would say if you have the ability to modify those form letters and put a little bit of personal spin on it, that's always best. That way it's like saying something new, but mail is mail. It all goes to the same place.
okay. Well, thank you again, Samantha. And I imagine we'll have more questions for you as we open up the Q&A. So back to Liza. Thank you.
Thank you, Michael and Samantha. I know in the Q&A, some people have asked, and I want to point out that on the Long COVID Alliance website, it has all the links to take action and support these bills. Additionally, on the there are 3 different options to take action on the Taskforce bill for the Marked by COVID website. And so there's multiple ways to get involved, accessible to you. I'd like to invite all the panelists back on screen to open up for multiple questions and discussion. And I'll start off with one that I saw recently. Is there a bill number for the House's version just mentioned? And I'm sure that was referring to 71489.
Oh, that's HR 1616 for the Care for Long COVID Act in the House.
Thank you.
Happy to help. Lots of interesting questions coming into the chat. But one theme that I'm sensing is a lot of folks kind of are sharing that sometimes they feel just frustrated or disengaged because they don't think that they're making progress. So what would you say, especially Gil or Samantha, to folks who say, I wrote to my senator and I don't feel like I'm making progress? What should they keep writing? Should they try calling? Should they work with other advocacy organizations? Like, what would you recommend is the best for folks who are feeling like they're not making through the noise?
I feel like I can just say yes to all the questions you just asked. I think, the Care for Long COVID Act and the Long COVID Support Act are really great examples of like people not feeling like their voice is being heard or not seeing things happen. But I don't think we could have introduced the Bipartisan Long COVID Support Act had we not had 2 years of Solve and Long COVID Alliance and other groups doing all of this outreach and sharing their stories, going to Hill Days. It takes all of that sometimes to like build up behind the scenes before we're able to get a bill introduced. And honestly, like we had a lot of conversations and we're working really closely with that office for a number of months before we even landed on a final version of the bill to introduce. So while some of that stuff isn't made public, like things are happening behind the scenes and like that outreach is beneficial.
And I mean, I would echo everything Samantha just said, but finding ways to amplify your voice, like joining wonderful organizations like this, aligning yourselves with other like-minded folks who are asking for the same thing, finding other coalition partners, whether that's other organizations that you're a part of, or going to reach out to other organizations, but building coalitions across many different diverse interest groups, and particularly in the in the states and localities that we need members from. We're only as good as what our constituents ask us for. And, it's one thing if every New Yorker is asking for this. That's not enough to pass it in Congress, I'm afraid. You need, Americans from every state really to be rising up. So think about it from that point of view, and hopefully that's a little helpful.
Thank you. I have a question for Gil. What is the expected outcome of the commission? A report like 9/11 commission report?
Yeah. So it's an 18-month, or after 18 months, they'll have a report that will, be a big stack of things. After that, Congress could could call them in to present their findings. There'll be different various vectors as to how we kind of unpack that all, just like we did with the 9/11 Commission.
And for anyone on the panel, are there any provisions in the legislation being discussed that must be passed by Congress and cannot be addressed via the committee or an executive action? And if so, what are they? And any provisions that the executive office can address without congressional support, and should some of our advocacy be addressed to the—
Oh, I see. On the National Task Force, I mean, yes and no, right? The things that we know for sure we need to do in terms of pandemic preparedness, yes. But for the kind of post report actions, we kind of have to wait for the report.
I would also just jump in to say that these types of postmortems are totally standard. And I, being sort of the curious person I am, kind of like dug around to kind of figure out like how many of these have happened over the course of history. I'm very familiar with the 9/11 Commission report and the monumental amount of press coverage that got, but then also the sort of entire ecosystem of changes that came as a result of that commission. Gil was sharing with us earlier, an entire new department to the United States government was created because of that. Imagine what we could do with something after this. So, it is absolutely commonplace. And just to throw it out there, in the 33 years between 1989 and 2023, there have been 170 different types of task force, of commissions enacted by Congress. And that is as of February 6th of 2023. I got that from a Congressional Research Service report that's publicly available. So the fact that we are not doing this is an absolute abdication of responsibility, and just causes me to ask, what do we have to hide as far as what we did underneath that emergency order? And just to address some of what I'm also seeing in chat as well is that we know that COVID is still here. Many of us are unable to go back to normal, whether that means you are permanently disabled because of your COVID infection, or you're dealing with other impacts of COVID, or are high risk for severe disease or death. We are not going to be able to advance any sort of here and now issues if we cannot actually come clear as a country about what we did underneath an actual policy. And so for me, as a still COVIDing advocate, this is a place in which I pour myself into, because it really will provide us the roadmap to not only address what has happened, but what is currently happening. And then on the other piece I was just thinking about was that it's hard. Advocacy is not easy. And I really appreciate our two staffers from Lawmakers Office being here with us today, but sometimes folks don't respond. I think for every sort of email I send out, I expect to have to send another 10 or 20 more in order to get a response. So for somebody who needs sort of a little bit of a pep talk on just feeling that you're not being heard, I hear you. Don't give up. Persistence is key to getting these things done. And I wish it didn't have to be that way, but unfortunately, that's how it is sometimes.
Thank you. I want to ask, and this question might be targeted to Emily a little bit. There's a question, there's an understanding that nearly half of people with long COVID meet the criteria, diagnostic criteria for MECFs. How is MECFs being included in the bill, and where do the long COVID clinics send MECFs patients, both diagnosed before and after? Do you have any information regarding that?
Well, I don't want to take Samantha's thunder, but the Care for Long COVID Act actually specifies MECFS as one of the comorbid conditions that need to be educated about. And the Support for Long COVID Act, which was drawn from the Long COVID Support Act, which was drawn from the Care for Long COVID Act, does have those medical educations, though not in that same specificity. But we know, and I can definitely speak to the overwhelming interest in MECFS that long COVID has generated, as folks are exactly drawing that connection, Cynthia, that so many long haulers or people with long COVID are meeting the criteria for MECFS, and that we knew from SARS-CoV-1, the first incarnation of the SARS virus, that about 27% of people who had that virus, the first SARS virus, ended up with MECFS or MECFS-like symptoms following. So this is a continued expected trend, and the legislation does address education on comorbid conditions, and then the Care for Long COVID Act specifies MECFS as one of those conditions that need to be educated about. So Samantha, I know I stole your thunder a little bit, but feel free to jump in if there's anything you want to add on that point.
That was great.
And for the panel, is there any legislation in the works to implement any type of universal protection, such as masking protection in healthcare settings? Examining post-COVID responses, great, but it would be better paired with measures to address current COVID pandemic and high levels of transmission.
I'll try that one. I feel like it'd probably be nearly impossible to arrive at something like that without a commission being, or a task force being passed, without a comprehensive authoritative report that details, apolitically what the benefits and risks are, for masking in hospitalized settings. Otherwise, we're just in the same place where, otherwise with no other new information, we're kind of just in the same place with masking, I think, as we've been.
And is there, in general, for those struggling, is there means, or does anybody have any resources for financial assistance needed for medication from symptoms resulting from long COVID?
That's a difficult one. Kristen, I'd love for you to jump in if you have any thoughts, but I'll just flag that this is an area that is incredibly difficult for so many reasons. And I feel like we need a whole different webinar just to focus on those services and supports. But the executive order issued by the Biden administration made clear that long COVID is considered a disability. So you can apply for SSI or SSDI under long COVID. And again, there are many, many problems with those services, but that would be the immediate first go-to. If your state offers a 211 service, I strongly recommend using the 211 intake service to talk through where your disabilities and medical needs are. And there might be some state or local programs that that again, if your state offers a 211, you just dial 211 on your phone, it connects you to a resource coordinator, and you tell them, walk through what your needs are, and they can connect you to state and local resources there. The other source that I would recommend for those who have been diagnosed with MECFS specifically, there is a financial resource fund through the American MECFS Society. It's a very small resource fund, but it's for emergency bills. That is one source of emergency funding for folks who are in crisis and need support. Kristen, any other thoughts that you'd like to add?
I think this is a really important question. What's been provided is absolutely insufficient. And I think one of the things that kind of keeps me up at night is knowing that there are so many of us that don't have the financial resources to, one, not be able to work, two, lose our healthcare insurance because we're not working at the thresholds that we need, and three, there's still countless people who are not aware of what's going on in their body because of COVID infection and don't have access to the types of tools, communities, networks, and so on and so forth. We have not done enough to address the cataclysmic consequences of over 1 million people dying in the course of 3 years. To give you a little bit of perspective, I became an activist as a little young girl, looking, being in sort of the depths of the HIV/AIDS crisis. I remember very clearly in the early 90s, seeing President Bill Clinton and then First Lady Hillary Clinton looking over the AIDS memorial quilt when it was at the National Mall, and it clicking for me as a little girl that those were people that we had lost. And it really fundamentally changed my life in thinking about my role in it and what I wanted to do with myself. And the reason why I'm bringing that up and bringing it here is that between 1980 and today, we have lost 700,000 people to HIV/AIDS in the course of the last 40 years. That is a cataclysmic amount of people. And yet we've lost over 1 million people, 1 million people in just 3 years. And that's not even counting the tens of millions of people who are sidelined from long COVID. I know this very personally. My mother has long COVID. In addition to my dad dying, we are constantly trying to figure out how to rob Peter to pay Paul to keep up with her medical bills, in addition to doing the work that we do for the community on behalf of Marked by COVID. I wish that I had a better response for this question, other than it is insufficient, and it is up to all of us to continue to raise those questions, not just of one another and fighting one another, but of people in charge. Whether that's at our city council meetings, because I go to those and I ask these questions, whether that's your state legislative meetings, because I go to those and ask these questions, or to hearings in Congress and establishing a relationship with your senators and federal lawmakers, as well as governors. They need to know that recovery has to include people. Recovery has to include ensuring that we are also part of an economic future. So get rowdy. That is my advice.
Kristen, I love your response and I love your passion, and I totally agree. I just want to share one anecdote. It inspired me to remember when I was in autism, we specifically represented children in South LA with autism, and it was a very niche group, a group that was often left off and forgotten in a lot of the actions around it. And so one of the first missions that we did was make sure we were in the room. Make sure that when the conversations around these needs were being discussed, was someone mentioning this community? And so we've started there with, are we in the room? Yes. Thank you, Samantha. Thank you, Gil, for everything you have done to make sure that these issues are in the room. And even if we cannot be, you are our voices in making sure that these concerns are continually held. And so be in the room is my encouragement to you. If you can, either with your email chats, with your actions, as Samantha described, getting involved with organizations, reaching out to your legislative offices, or sharing your story through other media like social media or newspapers and op-eds. All of these things make a difference. So make sure you're in the room, make sure your story's in the room. And that's one way that you can really start making sure these changes are heard. That are we having the conversations about this representation? Nothing about us without us. Are these communities being represented? And I think that is the first step to making sure that we have the broader changes we need, because are these concerns being heard? Exactly. Get rowdy, make sure they're heard, and just cannot thank you, Kristen, enough for sharing exactly what was going through my heart. And it's a process, it's a journey. We're not at the end point yet, and we need to keep fighting to get there. So I know, Liza, that we have just 3 minutes left. We have time for maybe one more quick question.
Yeah, and I'm sorry, you may have to find the question. I am not being able to read different screens today, you guys. Sorry, I am impatient. I struggle with the eye tracking things, and it's a day for me.
Absolutely. So I think I'll just sum up the last question with we touched on this in a couple of different ways. There's a couple themes that have come up, but a lot of themes around prevention. We're talking about what is still being done for the folks now that can make a difference in these long-term outcomes, because as Kristen said, COVID is still here and people are still dying, and this is still a very real crisis. So I guess to our advocates and to our legislative partners, how do we strike the balance in communicating around addressing the past, addressing what has happened, addressing the losses and urgent cataclysmic needs, and yet still wrestling with the fact that it's still here and it's endemic and vaccines are still coming out? How do we communicate kind of the messaging? It seems almost like a dichotomy, but how can we communicate, yes, we need these things now, and we also need these things to address what has happened? How do we wrestle with that?
I will start and others can jump in. I think one thing that Senator Kane has said a lot is that we may be beyond the COVID public health emergency, but the long-term impacts of COVID and the experiences that we've had over the last 3 years will be with us long into the future. And the two things that he often references is will be with us in the form of long COVID and all of those that are living with long COVID still 3+ years later, but also the public health ramifications of the pandemic, whether it be the loneliness you experience, seeing members of your family passing due to long COVID. There are a lot of different reasons people are struggling, and that we have to take what we have learned and we have to make changes moving forward. I saw a question in the chat asking about data collection and data reporting, and a lot of that has ended because of the end of the public health emergency, and Senator Kane has a bill to address that, the Improving Data and Public Health Act, which would better collect and encourage sharing of data across public health departments at the state and local level and the federal government as a way to better respond and prevent future pandemics. And I think that's just one example of how we take these lessons and grow, but I imagine others on this call might have other ideas as well.
Absolutely. Well, that actually takes us to the end of our time together today. So thank you all so much for joining us for this really amazing webinar. Gilbert and Samantha, especially thank you for all of your hard work and joining us to share a little spotlight into all of the great work you do. And someday we'll get to see even more as we do more webinars like this. So thank you all so much for joining us. Thank you, Marked by COVID. Thank you, Long COVID Alliance. And on behalf of Solve ME, thank you all for joining us. Again, this webinar has been recorded. So if you'd like to go through it and see it again, you can see that on the youtube.com/solvecfs or the Marked by COVID YouTube as well. And last but not least, I'd like to send a special thank you to our panelists, Michael and Kristen. Thank you for representing the community and joining us to share those important insights. And Liza, our moderator extraordinaire, thank you for your time and expertise. It's been a true pleasure, and I've learned so much from this. We look forward to joining you all for the next webinar in the future. Take care and keep advocating. Keep getting rowdy, y'all.